Hello, I'm your host, Neil Howard, here on Health Professional Radio. Thanks for joining us here again. I'm glad that you're here. Our guest is Dr. William Haseltine. He's a scientist, a businessman. He's also an expert in biotechnology and health system development, and he's joining us here on the program today to talk about his upcoming book, World Class, a story of adversity, transformation, and success at NYU. Welcome to the program, Doctor. Thanks for taking the time.
Thank you for your time.
Well, a bit of background about yourself. I did say that you're a scientist, a businessman, and more. What's your background, and what are you involved in now?
I was a professor at Harvard Medical School in the School of Public Health, doing research on cancer and AIDS. During that time and later, I created a number of biotechnology companies. I served as the chair and CEO of that company. And together, all the companies that I've created have brought about 8 drugs to the market that are approved by the FDA for a number of different diseases. Over the last 10 years, I've been focusing on improving access to high-quality, affordable health care, both in the United States and around the world. I've written a series of books which focus on best practices in healthcare systems around the world, and elder care as well. The current book, World Class, focuses on the U.S. healthcare system and how we can make it higher quality, more accessible, more patient-friendly, and affordable.
Now, this book, World Class, a story of adversity, transformation, and success, there are lessons that were learned from a transformation at NYU. Is that correct?
At NYU Langone, yes, that's right.
Talk about why that transformation was needed.
The transformation of NYU Langone was needed because it was losing the healthcare system, the patient care system, the hospitals, and the medical school were losing enough money to bankrupt the entire institution. That is NYU University itself. It was really necessary to make a change. The change was made, and this is a general lesson for all people in business, a turnaround story of how to use information to improve management. The original subtitle of the book actually was Successful Management in the Information Age. Information transparency is absolutely important, not only for management to know what's happening, but everybody in the organization to have horizontal transparency. Too often, a doctor will not understand what another doctor doing the same service in the same hospital is doing, what their performance is. For example, if they're doing a hip transplant, how many units of blood they're using, what kind of infection rates they have, how many days the patient will stay in the hospital. Once you have a comprehensive information system that's real time, that allows vertical and horizontal transparency, you can really focus on what matters to the patient, what matters to the hospital, and what the cost per outcome is. And that's really important in turning around any institution.
Would you say that Langone, having been at top of the game and then dropping, then being back on top of the game, are the same lessons applicable if you've been to the top and fallen as if you're just starting out and having a hard time getting that success?
I do. I think the lessons are clear. The first is how to create a culture not of complacency but of aspiration. Any organization needs an aspirational culture. Let's try to be the very best we can be. Let everybody else do what they can do, but if we're the best, we can compete with anybody. That's for institutions which exist and institutions which are being created. The proper use of information, capturing everything that the institution does, and holding everyone accountable for their performance based on it is another key lesson. It can be applied both to patient care and it can be applied to research and to teaching as well. I would say finally, for care institutions, it's really important to understand that all of these changes at NYU Langone were made for the benefit of the patient. How to make this more patient-friendly, how to make it more accessible, how to make it less hassle for the patient. There are 2 key lessons, I think, that take away for anybody delivering healthcare services. First of all, focus on day care, patient care, rather than in-hospital care. Safer, more convenient to the patient, and it's less expensive. Very key lesson.
Where can our listeners go online and get some more information about about you and about your upcoming book, World Class?
There are several sources. First of all, the book is available. It's an ebook and a hardcover book on Amazon. Secondly, there is a website, WilliamHaseltine.com. William Haseltine is one word, .com, which is a author's website. And finally, you can learn more about the founder and now chair of, which is www.accessh.org. www.accessh.org.
Well, I thank you for joining us today. It's been a pleasure speaking with you.
Thank you.
Been listening to Health Professional Radio. I'm your host, Neil Howard. Transcripts and audio of this program are available at hpr.fm and healthprofessionalradio.com.au.
Thank you for listening to Health Professional Radio. We're very proud to be an independent broadcaster providing our content free of charge to you, the listener. One of the ways that we're able to remain free and independent is by having people like you become patrons. You can support Health Professional Radio simply by visiting hpr.fm and clicking the button that says Become a Patron. Your patronage of even just $1 a month lets us know that you're there, which in turn makes us more valuable to advertisers. And, of course, if you're able to afford more, then we would certainly appreciate the support. My name is Toby Longhurst from Health Professional Radio. Please visit hpr.fm, click the Become a Patron button, and support us if you can.